We shall now step towards health and nutrition. The famous host here is Dr. Shambhu Banik, and today Dr. Banik questions a famous professor at Howard University College of Medicine on diet and cancer prevention. This professor's good name is Dr. Lalita Kaul.
Good morning. Welcome to Global Television Network's Health and Nutrition program. This morning, we are again very delighted and happy to welcome one of the outstanding authority on nutrition and cancer, Professor Lalita Kaul of Howard University. Professor Kaul, welcome back again.
It's a pleasure.
By popular demand to Global Television Network.
Thank you.
Last session, you talked about causes of cancer. This session, I would like to request you to highlight how these deadly disease cancers can be prevented. What are some of the preventive measures that we can take?
Preventive measures, again I would say weight.
Weight.
Yes,
Okay.
within a range, just not be obese. Is very important, especially in breast cancer, colorectal. What happens in breast cancer, if your diet is high fat, it gets deposited in the body and it releases a hormone called prolactin.
Prolactin.
Yes, and that is carcinogenic. Also in the breast cancer, what happens is if there is more fat in the diet and it's reserved in the body, it also causes more uptake of estrogen. And so there is an estrogen dependent breast cancers. As you know, there are different kinds and the doctor plans the treatment accordingly. So to show that if you have too much fat in the body, then it can give rise. And same thing to prevent colon cancer is have a diet high in fiber, not simple sugars. And prostate cancer, from our own studies, we saw the relationship of too many processed foods.
Processed food.
Yeah, because they're so convenient. Everybody wants to, make a sandwich, but they're high in salt, they're high in processed, and cutting down on cured, too much smoked food. Once in a while it's okay, but to be regularly eating that, so you can prevent by doing this. And so I said fiber, weight, vitamin C is very important.
Vitamin C?
Yes, it's called an antioxidant. Antioxidant is, it prevents the breakdown of the systems, in the blood or anything. And so vitamin C helps in the formation of nitroso compounds. So like you could take bacon and take vitamin C, but you don't do it. But vitamin C is very important, and one thing about vitamin C is it is a water soluble vitamins. So you need to take it every day because extra is excreted in the urine, unlike the fat soluble. So vitamin C is so prevalent if you like orange juice, grapefruit juice, any fruits fresh, because during the process of cooking it's destroyed. So vitamin C, vitamin A foods, high fiber diet, so these will be the prevention.
You say antioxidant. Now we hear about the berries, blueberries, strawberries, blackberries and all these things. Can you comment on that?
They also act, all these berries are very good fruits for the body, even for heart disease or cancer. And they have this property being antioxidant. Antioxidant is to prevent forming the red cells. It's like an oil. Oh, the other thing very important is if you use oil in cooking, frying, and usually we used to in the old days save it, cover it, but no, just throw it away.
Oh, really?
What happens is if you keep it like covered, okay, I'm cooking day before, the radicals form, the oil change, so it's a carcinogen.
Okay.
So, this is the debate going now in the country, is they are trying to have the fast food and restaurants to comply to help to have a healthy people. So, they, as you must have seen in fast food places, you have salad bars, you have this so many things, but the now big controversy is when they fry French fries, they take it out and use the same oil. They start in the morning, cover the cover, use it next day, but you form oxidants. Oxidants is these are double bonds. When they break down, they form these dots. That means it's break down, which can lead to carcinogenesis, which is cancer. And I know even my mother, when we did frying, she would just quickly, I'll go and throw the oil. And so that is another thing. Not every time you cook, use the fresh oil. Don't use leftover oil.
So, it is very prudent that you throw away the oil.
Yes, just throw it. But how often do you, if you do a lot of frying, I mean, it's better to use less oil, like just throw the oil, because the cost benefit, you might be saving some money, why waste it, but the risk to your body are greater by using leftover oil for cooking. So, no leftover oil for cooking.
Thank you. That's a very important information. I think
Yes.
that many families, I know Indian American community and other communities, they save the oil for the next day. They think it will be much more tastier.
No, no, it is not good for the body.
Okay, good.
It can slowly lead to.
Thank you for this information.
Thank you. So, I talked about weight, fiber, vitamin A is very important, because if the body is deficient in vitamin A, as we know, vitamin A is a fat soluble vitamin. So, if you find your patient deficient, that means they have been for a long time not using. We store almost 6 months to 1 year vitamin A. So, you are not taking. So, vitamin A is found in vegetables and fruits as carotene, but the best ready-made source is, animal sources. So, we are staying away from other reasons. So, vitamin A plays very important role in the cell growth, but vitamin A, vitamin C, high fiber, not taking refried oil. And that is the danger in the fast food, because you love fries, they are again dumping in the same oil, then you eat it. But once in a while is okay. I mean, I love it. I go sometimes, say, okay, I'll make it up.
How about French fry? McDonald's French fry is very popular.
Yes, yes, they're very good. They're very good. But again, if you feel that you have to, now Michelle Obama has helping with the changing the food habits of the school children, besides the exercise, the movement, is if we can bake, there are recipes for baking. You can boil the potatoes and then cut them like French fries, and then spray the oil on the sheet and just bake it.
Oh.
And it comes tasty.
Beautiful, thank you.
Try it, I have tried it.
Maybe next time you can bring some.
Oh yeah, I'll bring it. Yes.
Okay, we'll share that. Okay.
Yes, yes.
Okay, now, so these are dietary prevention, correct?
Oh, another thing I wanted to bring is,
Yeah.
there's a lot of talk about phytochemicals.
Oh yeah,
these
what
days.
is phytochemicals? Yes.
Phytochemicals, you will see also in the market, they have tablets, phytochemicals. They're not food or vitamins, but they play as a role as a non-vitamin, very important in prevention of cancer, in heart health. And these are fruits and vegetables, even with the skin. They're very high in phytochemicals.
Skin of potatoes and vegetables?
The vegetables, yeah, not potatoes necessarily, fruits and vegetables.
Fruits and vegetables.
Like broccoli, don't throw away the stalk, or
Apple, how about apple?
Apple, yeah. If you can, just but wash it very well, so that all the spray, they keep it to fresh, so you get it off. So phytochemicals are very important function, and more people, you have even phytochemical yogurt now with high protein, and they are very, very important. And then there are a lot of sources of phytochemicals.
Can you share few of the
Yes, phytochemicals, cabbage, broccoli, very important, cabbage, broccoli, cauliflower, or cherries, these are all very important sources of in the diet, and they have different chemical names, but which I won't bring it. Cabbage is excellent for your
cabbage.
Yeah, phytochemicals, cauliflower, Brussels sprouts.
Brussels sprout?
Yes, Brussels sprouts, kale, which is coming. Kale.
Kale. How about spinach?
Spinach is excellent source. Gives you vitamin A, and it is very good. You can even take, just put it in dal, put it in every food you eat. The spinach is very, very important. And yeah. Anything else?
During the last segment, we talked about this saccharin and all these sugar substitute, and you mentioned these are also some causes for cancer. Could you comment on that?
FDA has been very strictly regulating.
Yeah.
We had several studies, but they have kept saccharin, and then there is Splenda, which is made from natural source, which I recommend is the best. But there are some
Splenda is better?
Yes, it is made from natural source.
Oh, okay.
But some people get allergic through the process. And then there is one called Equal. It's made from aspartame, which is an amino acid. And then there is some people who are they have kidney problems, they cannot take it. So you must ask your doctor or health professionals.
Let me ask you about Equal. I generally use sometimes, Is Equal okay?
Equal is okay if you don't have any problem with kidney or other problems, because it's made from aspartame, it's an amino acid, and saccharin is okay. Why the FDA let it be allowed was because they found that they did the rat study that humans have to take so many of them, you cannot take. But the cost benefit ratio was that the benefit, especially if you have diabetics, triglyceride, and they cannot take without sweetness, so you can use. So I tell my patients to use in moderation, or even a diet soda in moderation, because some studies have come caramelization and other process. Just moderation is the key.
We have got 45 seconds left. Would you summarize about the prevention of cancer to our viewers?
Prevention of cancer: keep your weight within the range you are comfortable with. Eat diet high in fiber, low in sugar. Don't include too many processed or cured foods, just in moderation. Exercise, low fat diet, and this is your recipe from the prevention of developing cancer.
Professor Kaul, this segment will be aired during the New Year's. Could you like to share with our viewers some greetings for the Happy New Year?
Happy New Year, enjoy, and if you are having party, enjoy it, and then come back to your routine. You don't have to overdo it. You like to have a dessert, you have to have sure. If you are diabetic, make sure you are covered, whether it's insulin or medication. You don't want high glucose to be in your body to affect your nerves, but enjoy. Moderation, moderation, and moderation is the key.
Thank you very much for coming and sharing your views with our viewers. In our next segment, next year, we'll talk about your award-winning recipes.
Sure. Thank you.